Okay, so the lymphatic system. Lymphatic system does all these things. It's just a network of vessels that we don't often think about, but it's similar in how our circulatory system is, although there's nothing really pumping through there. Its its job is to drain excess fluid away from our interstitial spaces, and it takes those fluids to the bloodstream, transports fats to the bloodstream, helps protect our body against disease. So look at that. Okay, so the fluid inside the lymphatic system is called lymph. And lymph is any tissue fluid that's entered the lymphatic capillary. So these capillaries are these single-celled, right here, these single-celled structures that are able to take the fluid from the interstitial spaces and bring them into the lymphatic system. Okay, so lymph movement happens because, well, it gets forced in just due to pressure differences, but there's oops, sorry, I'm trying to move to the next one. There we go. So the lymph movement moves through the lymphatic system, kind of like how the blood moved through the venous system, in that the skeletal muscles contraction causes the lymph to move. Respiratory movements, when you get the lower pressure in the thoracic cavity, causes the lymph to move. And then there's also smooth muscle in the larger lymphatic vessels that can cause it to move. Lymph vessels also have valves in them. The valves are similar to the valves that are in the veins. Okay, so the lymph nodes act as checkpoints for the lymphatic system, and they filter out these potentially harmful particles from the lymph, so viruses, bacteria, and there are macrophages, T cells, B cells, all in the lymph nodes, and those are there to kind of be in immunosurveillance as a function to make sure anything coming in is supposed to be there. There's also areas within the lymph nodes where lymphocytes are produced. So we've got a bunch of places where you have them. So you've got the cervical lymph nodes, and these are the ones that your doctor feels or your nurse feels in your neck to see if you have an infection. You know, when they say, "Oh, let's see if you have swollen glands." The cervical lymph nodes drain the face, nasal cavity, the pharynx, and the scalp. The axillary lymph nodes near your armpits drain the arms, your lateral thoracic cavity, superior abdominal cavity, and the breasts. Supratrochlear lymph nodes drain your lower arm and elbow. Usually, though, by the time you're an adult, those have gone away. Inguinal drain the legs, scrotum, your inferior abdominal cavity. Pelvis drains your pelvic region. Abdominal drains your pelvic region. And then thoracic cavity, lymph nodes drain your internal thoracic cavity. When the lymph comes in, the afferent vessels carry it in. So these are, say, carrying it from the where it was produced, and it's carried into these lymphatic vessels. And when it gets into the lymph node, notice there's a lot of it coming in, a lot of ways for it to come in, but only a couple of ways for it to leave. So this slows down that movement. And think about if you had a place where you had 4 rivers coming into a lake and only 2 rivers leaving. There's going to be a lot of mixing in here, and that mixing allows your macrophages and your B cells to determine, and your T cells to determine if there's a bacteria or a virus in there that's not supposed to be there. All right, lymph formation starts in the capillaries, moves into vessels, then trunks, then collecting ducts. So this is what the lymphatic capillaries look like. They're microscopic tubes, these green ones. Now they're not green in real life, and if they are, you're in trouble. And they are closed-ended. The lymphatic capillaries actually run within your circulatory system, capillary beds. So a place where you get a lot of fluid movement, they're made of simple squamous, and you get fluid filled in from the interstitial tissues, fluid forced into there just due to the osmotic pressure differences. So when that fluid gets forced into there, then we call it lymph. All right, so you get that lymphatic capillary. Fluid moves into the vessels, and this is all, remember we just talked about the skeletal muscle contraction, pressure differences due to breathing. From the vessels, it gets forced into the lymph node. So you get the afferent vessels into the lymph node and the efferent vessels. The vessels, afferent vessels, lead into a lymphatic trunk, which leads into a collecting duct, and eventually into subclavian veins. All right, the lymphatic vessels come after the capillaries. Still endothelial tissue, but there's a small amount of smooth muscle, some connective tissue, and you start to have those valves coming into play to prevent the backflow. The collecting ducts. So you get these 6 collecting ducts. The lumbar, or collecting trunk, sorry. The lumbar trunk drains everything from your lower limbs, the lower abdominal wall, the pelvic region. The intestinal trunk drains from the abdominal organs. Intercostal trunk and bronchiomediastinal trunk are draining from the thorax. Subclavian trunk from the upper limbs, and the jugular trunk drains from the neck and the head. All right, then there's 2 collecting ducts, the thoracic duct and the right lymphatic duct. The thoracic duct is the larger one and starts in the abdomen, and it moves up in front of the vertebral column. And that's going to collect, the thoracic duct collects from the lower limbs, the intestinal, intercostal, lumbar, left subclavian, left jugular, and left bronchomediastinal trunks. And the thoracic duct empties into the left subclavian vein. The right lymphatic duct collects from the right jugular, right subclavian, right bronchomediastinal trunks, and empties into the right subclavian vein. So look at the table in the book, because it's a good table in the book for this also. All right, and the other organs of the lymphatic system, you've got the spleen. The spleen is actually the largest lymphatic organ. And it's in the, remember from AMP1, the upper left abdominal quadrant, and it has sinuses that are filled with blood. There's 2 kind of tissue types in there. There's the white pulp and the red pulp. The white pulp has lots of lymphocytes in it, and the red pulp has lots of red blood cells. That's why the spleen is like a reservoir for blood. There's also lymphocytes, macrophages, in there. Okay, the thymus is in your thoracic cavity, and the thymus is a place where T cells mature. We'll learn a little bit more about those. And in adults, the thymus is pretty shrunken, and it, as an older person, it's mostly fats. Remember when in the endocrine system we talked about thymosin, that hormone thymosin. That thymosin helps in the maturation of those T cells. And you've got the tonsils and the adenoids, and the tonsils and the adenoids are lymphatic nodules, so they're like mini lymph nodes. All right, that's the end of part 1.